I'm here in Chicago at the 2017 ASCO meeting, and I'm here presenting a very important abstract on bone disease, wherein we've done a very large randomized trial of more than 1,700 patients, comparing the use of standard of care, which is zoledronic acid, to the other drug, which was the experimental arm in this case, called denosumab. Now, this is a really important trial, and in my mind may in fact be practice changing, because number one, it is the largest trial in myeloma that we've had as an international multi-site effort, with more than 29 countries included from all over the world. And importantly, it may in fact give us an additional option of treatment for bone disease, wherein the standard of care for more than 15 to 20 years has now been zoledronic acid. What we did here was took 1,700 patients, it's a little over 1,700 patients, and these were randomized in a double-blind randomized fashion, so that half the patients, 820 odd patients, got zoledronic acid or placebo, and this was compared to denosumab given every Q4 weeks at a dose of 120 milligrams subcutaneously every 4 weeks, or placebo. What was interesting to see out here was the fact that these were patients who were newly diagnosed. We did stratify for certain factors, and the most important factors that we stratified for here was the fact that they had access to new drugs, whether or not they got transplanted or not. We stratified for stage of disease as well. And what we found here was the fact that denosumab did just as well as zoledronic acid with respect to first on-study skeletal-related events. The trial was designed so that it could show equivalence, and it did show that. We also did not see any survival disadvantage, and this is quite important in the myeloma world, because up until now, denosumab is not approved in multiple myeloma, because there was older data which did suggest in some of the older studies that denosumab patients did not live as long as patients treated with zoledronic acid. In this very large randomized trial, we did not see any differences at all. What was absolutely striking actually in this trial was the fact that, unbeknownst to us or unexpectedly, we found a very significant improvement in progression-free survival. And that improvement in PFS was to the tune of about 10 months. It's unclear as to why that is, but this is something which needs to be investigated. Another very important feature which needs to be highlighted, and which we are highlighting at this ASCO meeting, is the fact that patients with multiple myeloma, about 60% of them will present with kidney dysfunction, and denosumab was very safe in these patients. And more importantly, the incidence of toxicity related to renal issues was much lower in patients who were treated with denosumab, thereby providing a very important alternative to our patients who are otherwise commonly treated with zoledronic acid, have renal dysfunction, and cannot have any other bone protective agent.